Norman.
Go, Harvey, go!
The U105 Lunchtime Bistro is brought to you by Bloomfield Shopping Centre and Retail Park Bangor. You're already our best friend. Now become a Facebook fan.
Now, all sorts of queries have been coming into us since I mentioned that we were going to have a foot specialist coming in. It's not every day we get somebody come in and talk about our tootsies. And I'll tell you what, some of us don't treat them very well. Sean Savage is a podiatrist and he's joining us today for the first time. Good to see you, Sean. Thanks for coming in.
Yes, thank you, Caroline.
No problem. So, tell me then, what is the most common problem whenever people come in to see you? What is the most common thing that they have complaints about?
Okay, well, being a podiatrist, my protocol is usually the very end when someone's tried their doctor and everything. If they've got a sore foot, they then come to see their podiatrist. So usually when they've made that decision, they're either in pain with hard skin, a bunion, an ingrown toenail or whatever. But occasionally you do get people who come in who just want to look after their feet a bit better now. There's a lot more cosmetic issues out there, hard skin, fungal nails, thickened nails and things like that. So people wearing a lot more sensible or fashionable shoes want their feet to look the best. Mm-hmm. So I suppose at the minute, the main things that people want to get done is really hard skin taken off and maybe a bit of toenail care. Right. In my area, I sort of specialise a wee bit more in the sort of higher end of foot pathology. So I'm dealing with a lot more sports injuries related to feet, sore knees, sore backs, sore ankles, all related to the foot mechanics. So I'm seeing the more sort of, I suppose you could say, the more specialist types of foot care than a general podiatrist.
Well, what's the difference, Sean? What's the difference between a podiatrist and a chiropodist? I know people probably ask you that. It probably sounds so obvious, but I don't know. I'm asking.
It's actually a very good question. Well, chiropody is the old term, and one of the things was, which I found quite disturbing, chiropody is not a protected title, so anyone could really call themselves a chiropodist if they do a 6-week course and the likes that you see in the back of the Daily Mail and things like that. As a podiatrist, you do a recognised qualification, and you're what's called Health Professional Council registered, which means you've done a relevant degree, you've got relevant insurance, and you're a specialist in foot care and foot pathology. And usually you have to do a degree. It used to be a diploma, but now most universities will do a degree in podiatric medicine. Right,
okay. And I can't be thinking about people with dodgy things on their feet, but I mean, by the time to get you, it's like a last resort sort of thing. You must see some really unearthly sights. I mean, whenever you look at people's feet, do you not wonder, how did you get to this point?
Well, I wish I had a pound for everyone that says to me they have the worst feet, because I've never seen the worst feet. You always see somebody's worse than others. Right. I suppose one thing, in my area, I'm not dealing with the very high-end sort of ulcerations with related diabetes and things. I mean, I have a few colleagues involved in that area, and they're so high in my estimations. They are really seeing very, very difficult cases. Mm-hmm. Some things they're seeing don't even look like feet, and yet these guys can then salvage and make this foot back to a functioning order again. So yeah, we do see different types of feet, but most people in general do have a bit of good personal hygiene. So when someone makes the effort to come and see me, they usually wash their feet before I see them.
Yes, okay, so they're doing a bit of housekeeping first, right? Yeah. Fair enough. Well, let's get through some of the queries there that we had earlier on today. Now, Paul says, how do you treat a foot rash? Too embarrassed to go to the doctors. I'm a typical man. It's just on the feet, nowhere else. Well, what could that be? Okay, well, the very first thing, is it itchy? If it's itchy, it's no doubt it's tinnitus, which is an athlete's foot problem, which is usually a fungally related problem. And that's quite easy to correct with there's lots of different preparations that you can buy over the counter. And then you can also get prescription-only medicines. Probably one of the best is Lamisil AT or TA, which you see recommended on the television and things like that. Something like that for a few days would easily correct that. If it's not itchy and he's got a rash, does he have any sort of other systemic problems like psoriasis or maybe even some sort of contact dermatitis? Maybe he's wearing a pair of shoes, or he's allergic to the leather or synthetic within his socks and things like that. First thing, if it's itchy, put on some antifungal cream. If it doesn't settle, it's probably a good idea to see a podiatrist or your local GP. Okay, Paul, you can try that first and then see where that takes you. Anna in Belfast says, can you ask Sean what causes extremely hard skin on the soles of your your feet?
Okay, extremely hard skin. Well, callus or hypokeratosis, the calluses that grow, it doesn't grow there if nothing's irritating it. It's usually a shoe which is causing a bit of friction. And if you get a bit of friction, what's happening is, like, if you do a bit of hard work and you get a bit of hard skin around your knuckles and things like that, it's really just friction causing extreme pressure on the skin, which will then cause a lot of callus to grow up. The problem with callus is, as it gets thickened, it then becomes very painful. And that's a case where you need to take that off.
Why would you let it get thickened, though?
Well, a lot of people do. A lot of people, I suppose there's a bit of neglect. People just, they're not. It doesn't really problem them until it's sore. They're probably just aware
like
of it.
layer after
it
layer
can be
after
very
layer?
A very, very thick callus. And ladies who wear sort of backless shoes or flip-flops are more prone to getting a lot of callus. And you might see that unsightly callus around the backs of heels. Then it becomes very dry. It can break, and on occasions you can get bacterial infection or even fungal infection. So it's unlikely that somebody really allows that to happen now, because there's a lot of preparations, emollients, things that you can apply. But hard skin, it's usually, you have to look at what type of shoes she's wearing to see why she's getting so much hard skin.
Once you see the hard skin starting to develop, what should you do?
Well, again, try and think, is there a certain shoe, is it a sandal, is there a flip-flop that has maybe caused this? There's things you can do yourself. Applying some emollients, things with like peppermint and things like that are very good at hydrating hard skin. Other preparations such as Vaseline Intensive Care, those sorts of things are very good to use on a regular basis. You can buy little little rasps and things just to take some of the callus off, but just be careful. You can buy some of these little cheese grater like things that I've seen in some of the shops, and they look quite dangerous. I think probably Hitler may have used some of these in some of his people.
Where you actually shave off?
Yeah, where you actually shave off some of the skin. Now, the problem with doing that is you can take it right down to the very, very base, and it can be very, very painful then. So what I advise, if you're going to do that, you only take a little layer of it off, apply some emollient and things like that. If you take it down too far, you're going to leave it very painful.
What about the fish? You can eat this stuff off your feet. What do you say about those fish?
Well, okay, that was such a. I mean, last year that was such a phenomenon.
Look, everybody wanted to have the fish eating their feet.
Again, it's not so popular now because there's issues with cross infection and issues with maybe people having certain skin conditions, and could you contaminate the water and things like that?
Is it possible to do that?
It is, and in America there have been a few papers that have been written that states that there was an element of cross infection problems, and it's not really, I suppose, as popular as it was last year.
Yeah.
So
I didn't fancy the idea of it now, because I was thinking, people were going, but sure, they clean the water and all the rest of it, which of course they would clean the water. You wouldn't want to be putting your feet into somebody else's dirty water. But what was the fish were bringing whatever they were taking? If they were taking infection, they were maybe going to the next person.
It's probably that, exactly. Yeah. And maybe somebody have had some sort of systemic condition like psoriasis or things like that. Yeah. There's a chance where there's a bit of a bacterial infection, things like that could be passed on.
Yeah.
And
so you wouldn't recommend it?
You don't want to risk that. No, it's not that. I would just be very careful. If you have any open wounds or any types of fungal infections or dermatitis things, it's probably something you shouldn't be doing.
Okay. Large bunion, not sore, but the base of all my toes, on the sole of my feet, very painful. Plus, my toes look to be slightly swollen and a funny shape. Not having a good time there.
Not a good food type. Well, bunions. It's another name for it is what's called hallux subductovalgus, which is a deviation of your big toe, which exposes the joint. Now, in my thinking of a bunion is, if you don't irritate it, it won't irritate you. Ladies, the problem is if they wear very high heels or shoes that are quite tight around the toe box, it's going to irritate the bunion. What's going to happen then? It's going to get very inflamed. You're going to get a bursitis, which makes it very hot and inflamed, and that then can lead to lesser toe problems. You can then change how you walk and maybe end up putting force on different other areas of your foot. With the bunion, because of the deviation, you're going to get all the other digital deformities such as hammer toes, and you may even get a lot more pressure under the ball of your foot, and you could maybe get things like metatarsals, or Morton's neuroma, or even a lot of hard skin and things in that. So if you have a bunion, and what causes bunions? Well, different reasons. It's what's called multifactorial, so it could be a genetic reason, but certainly there is evidence to show that certain shoe types, particularly high heels, are going to make it more, you're going to predispose it to giving you pathology and pain.
Okay, and Roberta in Lisburn was asking about, she started the conversation about the Crocs earlier. She says, can you ask your foot doc, what does he think about wearing Crocs? Now, what's you? Okay,
well, Crocs. I mean, again, probably the good thing with Crocs, I always compare them to what's very bad for your foot. And people who used not to wear Crocs probably ended up wearing sort of flip flops and things like that. And flip flops aren't very good for your feet. So a Crocs, firstly, it's giving you that wee bit more support around the arch. It's also quite light on your foot. It's not very heavy, and it also has that element of shock absorption. A good thing too, it's perforated. So if you work in a hot environment, it's very good again to allow your feet to breathe and sweat. I know some of the surgeons that I would be quite friendly with, again, they actually wear their Crocs when they're doing sort of operations and things like that, because they're on their feet for long periods of time. Before, they would have worn a sort of a clog type shoe, which again was just very uncomfortable, and you're standing long periods of time. And again, some doctors actually even recommend them as part of a treatment plan. If you have issues with sore feet, I know some doctors in particular that might say, go get yourself a pair of Crocs and wear those when you're not wearing your shoes or slippers and things like that.
Just to give your feet a break.
Yeah, absolutely.
Well, what sort of shoes? Because we had Leanne in earlier, and she says she's on her feet working all day long from 8 o'clock in the morning until sometimes 6 o'clock, and she's asking, what sort of shoes would you recommend for someone? And we've got plenty of people who we know do it, who stand in a shop all day long.
Okay.
What do you wear?
If you need to look after your feet, if you're on your feet for long periods of time, it is important to be able to wear something that firstly is going to hold your foot in a nice position. It's going to give your foot support. It's going to cushion your shoe. It's going to cushion your foot, and it's not going to cause any irritation. Either it's not going to cause a lot of slippage and things like that, which could lead to blisters and hard skin. I suppose the ideal shoe would be something that your granny would probably wear, with little lace-up shoes. But I know that's not a sort of an ideal situation today. What's not a good shoe, and I see a lot of kids wearing them now, are these little sort of pump type shoes.
Everybody seems to be wearing those.
And they are a disaster.
Right, they're completely flat.
Not offering any support. Usually because they're slip-on, they slip at the heels. And what tends to happen is kids sort of curl their toes, so they're more inclined. They could cause more blistering. And another very big thing that can cause is ingrown toenails. If you curl your toes to try and hold the shoe on, you're more likely to cause an ingrown toenail, particularly of the first or second toe.
Yeah, so those pumps, you need to rule those out. They're not good.
Not very good.
Right, my name is Carly. I have a, how do you pronounce that?
Calcaneal spur.
Cancaneel spur in my heel, and I've taken anti-inflammatories but suffered side effects from them, had to stop taking them. Any other suggestions to relieve the pain?
Well, a calcaneal spur is what's called a heel spur, and what it is a little extra piece of bone at the base of your heel. An interesting fact is 50% of the population have them, but not everyone has pain with it. What happens with a calcaneal spur is it causes an inflammation as the tendon attaches into the area. And one of the very, very significant things is that is pain first thing in the morning when you put your foot straight down onto the, as you get out of bed, or sitting for a while and you get back up, you'll get a lot of pain. So there's certain things that you need to do. Firstly, you need to reduce the inflammation. So anti-inflammatories can help. Ice can help, things like that. In occasions, usually it's what's called a mechanical problem. So it's how you're walking, it's how your foot's functioning. Is your foot flattening out too much? You're wearing the wrong type of shoes. So certain things like arch supports, or what are called orthotics, which are specially designed medical devices that you slip into your shoe, will certainly support the arch area of your foot and take a lot of the stress off the spur. In occasions, as a podiatrist, I'm qualified, I can give certain types of injections. So corticosteroid injections, again, which are high dose anti-inflammatories, again, can work very, very well with that. And one other thing that can help is stretching your calf muscles. If you stretch your calf muscles, that'll take a lot of the strain off your foot, which will take a lot of the tension off the tendon, which is causing the spur.
Good stuff. Well, just to wrap up, a couple of queries in the phones here. Raymond says he plays sport and he's constant pain in his heels during the sport, especially the following day. What can he do? He doesn't want to give up playing sport.
Again, it might be a case where he might have a calcaneal spur. It also might be a case where maybe he's not stretching his muscles properly, so he's putting a lot more stress and strain in his feet. He then has to look at maybe what type of shoes is he wearing. If he's playing a high impact sport in hard ground and things like that, he might need more cushioned, more structured type trainer. You can buy these little gel heel cups, which again can be very good just to give you a bit more shock absorption. Or it is important maybe to go and get himself analysed, get his gait analysed, and get himself a proper fitting shoe. He may even benefit from some sort of an orthotic.
Right. Kathy's 2 youngest kids have flat feet, and she thinks her oldest does as well. Is there anything that can be done for flat feet? And also this ties in with Sally, who said, can you ask Sean, is there anything you recommend for my son? He's been diagnosed with flat feet, still waiting on podiatrist appointment. Any suggestions in the meantime? What's flat feet? Okay,
flat feet are basically when the child stands, it has no arch. Okay, I suppose you could also call it a pancake type foot, which is just really, really flat. Now the problem with flat feet is the child is more predisposed to getting problems, not just within his feet, but maybe his ankles, his knees, his back. So as a child, you try to treat every child as a potential Olympic gold medalist, so you want to give them the best start. So it's important to wear proper good fitting shoes. Now, if he has a flat foot, he's going to need something to control his foot, and that's where an orthotic or an insole can really help. Okay, so it's probably best that, firstly, if you're waiting on a podiatrist referral, make sure he's in a good fitting shoe. So the likes of, well, he's a boy, he's not going to wear the little pumps, but if she's a girl, those little pump ideas aren't very good.
Stop wearing those immediately.
A good stable shoe would certainly help. There used to be a sort of philosophy with flat feet that children would grow out of flat feet. Now, we say that children actually don't grow out of them, they grow into the problem. So it is important, if you're worried about your child or your boy as he's growing, getting flat feet, why not get him assessed? And it might be just a case of some exercise, a good fitting shoe wear, but on occasions you may need some sort of an insole to correct that problem as he grows. Okay,
we could keep you here all day. As you can see, the queries are flying in for you, Sean. A lot of people wanting to talk about their feet. Before you go, I would like to know, what does a podiatrist wear on his feet?
These 6 inch. No,
no. 6
I'm just wearing a nice pair of black Brogues.
Oh, right,
so they're
okay.
not too bad.
Yes,
yeah, they're fine, good.
Would you go and get your shoes made, or would you just...
No, not at all. No. We don't make that much money, us poor guys. So we just rely on sort of charity shops and things to get our shoes.
Your shoes look good to me. Right, if people want to get in touch, have you got a website address?
Yeah, my website is sportfeetni.com, www.sporty